What does a consult look like with an ambulatory care pharmacist? Hi guys, I'm Paige. I'm an ambulatory care pharmacist and I specialize in primary care. So for me, I manage most chronic disease states like diabetes, hypertension, hyperlipidemia, sometimes tobacco cessation, as well as obesity. During a consultation, it's going to be an information gathering and sharing session, essentially. I like to start off my consults by explaining who I am and what I do, that I'm a pharmacist, but I'm not a normal pharmacist. I practice under a scope of practice, and so their primary care provider has asked me to prescribe medications for the consulted disease state. I then like to go over what their goals for therapy are. So if we're talking to a diabetic patient, what is this patient's A1C goal? What are their home monitoring goals? How frequently should they be home monitoring their blood pressure, blood sugar, weight, etc.? After that, I need to know what they're doing and what might have influenced any lab work leading up to my consultation. So I'll review the medication list to make sure that I understand what they're currently taking. I'll also inquire specifically about medication use leading up to the most recently drawn A1C lipid panel. After that, I ask pretty basic questions about any side effects, any issues with adherence. I'll talk about diet, exercise, and social history as well to gather some information and provide education on things that they might want to change. And then I'll look at what data they have for me. So hopefully they have either blood sugars, blood pressures, or their weight to evaluate, and then I can prescribe medication changes to address it. And then we'll pick when we'll chat next. That will allow me to make sure they're tolerating the new agent well and see what impact that had on the glucose values or blood pressure values, etc. It's a very unique and very fun way of practicing pharmacy, in my opinion. I hope you keep following along for more pharmacy and healthcare fun facts.